So let's start at the very beginning. Why is gut health important? Now, I go back to the 5 pillars of optimal pet health, and gut health and nutrition is so important. But here's the thing, it integrates in so closely and intimately with immune health and environmental health, emotional health, and physical health. So as we go through this presentation, you're going to see how everything is interconnected and why other pieces to the puzzle are so important, and we don't want to forget about them as we focus on gut health. So let's talk about some of your senior dog aging changes that occur. We know that the maintenance requirements change as your dog ages. So they're going to have decreased physical activity. But here's the thing that's commonly missed. Senior dogs have increased need for dietary protein. So this is not the life stage that we want to start decreasing protein unless there's an actual medical reason for why we need to do that. We also see their body composition will change. We tend to see a reduction in lean body mass and bone mass. We can see an increased proportion of body fat. Our senior dogs tend to be more likely to become obese. We also see a reduced total body water too. As pets age, their sense of smell and taste becomes less acute, which can cause a disinterest in food. So in terms of palatability, older dogs tend to find room temperature wet foods more palatable, or your lightly cooked foods more palatable because of the soft texture. Also, as older dogs, their teeth may become more sensitive, making it difficult to chew the dry food. So if we have decreased sense of smell or interest in sniffing, we have decreased in vision. Also, those number of taste buds can decrease in our senior dogs. We also see digestive tract changes, where once again, when we're talking about gut health, we're starting from the very beginning of the gut health in the mouth, the oral cavity, so all the teeth, all the way to the rectal area. That encompasses the entire GI tract. And we see an increase in dental disease. So if there's loose teeth, inflamed gums, gingivitis, periodontitis, there can be changes there that cause pain and make them less likely to want to eat. We also see an increased occurrence of oral tumors like melanoma, fibrosarcoma, squamous cell carcinomas. One of the other big changes we see in senior dogs is that they can have a decreased pancreatic enzyme production and bile secretion. So it makes it harder for them to break down their food. We also see decreased digestibility of nutrients, especially fats and proteins. So if we're reducing the amount of protein they're getting, they're not going to be able to break it down as well into those amino acids and the nutrients that they need in order to achieve optimal health. Also, many senior dogs have too low of stomach acid to properly digest their food. This is also where the food they're eating may be creating more issues, especially if we're feeding processed kibble diets. This can create dysbiosis or an upset gut health balance where we have bad bacteria outnumbering the good. We might see symptoms of acid reflux, so symptoms like burping and bloating, constipation, gas after eating, and food sensitivities. And the problem that we see here is that a lot of our senior dogs are put onto antacids or proton pump inhibitors, so things like famotidine, omeprazole. And the problem is that with chronic usage of those medications, we can actually see vitamin B12 deficiencies. Our pets will have issues with absorbing iron and calcium and magnesium and other vitamins and minerals from their food, which can contribute to poor gut health and poor health in general. Some of the other changes that occur as our dogs age can include immune response changes, so increased incidence of infectious diseases and cancers, behavioral changes like cognitive decline, and also we see changes in the skin and the coat health, where we might notice the nose and the paw pads become more dry and thickened. We notice textural changes in the hair coat. Maybe it's more dry, flaky, scaly, oily. We also might notice that they're losing hair more readily, and also their muzzles and their faces become more white. So what do all these changes have in common? inflammation. And that's what we're going to talk about in this presentation is, where does inflammation come from? What are those causes? What diseases is this related to? And how is it all connected in the body? But most importantly, how can we use food and supplements to reduce that amount of inflammation that can occur in a chronic setting so that your pets, your dogs, they age gracefully? Now, we know many senior diseases in our dogs are actually connected to poor gut function, even if they don't seem related. So things like obesity, osteoarthritis, autoimmune diseases, cancer, cognitive decline, heart failure, hormonal imbalances, behavior issues, and there's a lot of other diseases that if we focus on what's going on in the gut and how do we optimize it, we can actually reduce the risk of these diseases from occurring, but we can also more easily treat these diseases if they've already occurred.